Hello, I am Dr. Stewart. We often see people for coughs, colds, sore throats, stuffy noses, and ear infections. These are some of the most common reasons that people visit a doctor. People want to feel better, and quickly. They often come in thinking that antibiotics will help them get better faster. Unfortunately, this is generally not true. Most of the time, antibiotics cannot help common cough and cold symptoms. Let me repeat. Most of the time, antibiotics do not do anything to help common coughs, colds, sore throats, or ear infections. In fact, antibiotics can sometimes cause more harm than good. Here's why. Coughs, colds, sore throats, stuffy noses, and plugged ears are caused by an infection. Most of the time, these infections are caused by a virus. In fact, if you have a combination of any of these symptoms, it is even more likely to be caused by a virus. Unfortunately, antibiotics do not kill viruses. Nothing does. The only thing that kills viruses is your body's own immune system and time. Antibiotics only kill bacteria. Bacteria are different from viruses. It is rare to have cough and cold symptoms that are actually caused by bacteria. People are often concerned about having a strep throat. A strep throat is a special kind of throat infection that is caused by a specific bacteria called strep. A classic strep throat causes an extremely sore throat, fever, and pus on the tonsils. There is usually no nasal congestion and no cough. In fact, if you have a stuffy nose and/or a cough, your infection is likely caused by a virus rather than having a true strep throat. If you don't have a fever, it is unlikely to be caused by a strep throat. Often, people mistakenly refer to sore throats as strep throats when their infection is actually caused by a virus. Again, unfortunately, antibiotics do not work on viral infections. If you have a true strep throat, though, we do treat with antibiotics. However, it is important to point out that antibiotics do not make you better any faster. You will still be sick for about 7 to 10 days. The only reason that we treat strep throat with antibiotics is to prevent rare heart and kidney complications that can result from a strep infection. People are often also concerned about having bronchitis. Bronchitis is a fairly common type of infection. It is an infection of your upper airways at the top of your lungs. Bronchitis infections are caused by viruses. Again, antibiotics unfortunately do not kill viruses. So why not just give antibiotics? The answer is as follows. Again, antibiotics do not kill viruses. So if your infection is viral, the antibiotics are not doing a single thing to help you, but they will cause you needless side effects, including stomach upset and diarrhea. They can often cause rashes and even more serious allergic reactions. Overuse of antibiotics leads to bacteria becoming resistant to them. This means that they will not work for you when you truly need them in the future. Again, the bad news is that antibiotics do not kill viruses. The good news is that your body will fight off a virus with your own immune system, usually within 7 to 10 days. Regardless of whether your infection is caused by a virus or bacteria, there are still things you can do to make yourself feel better. Nothing will make you feel 100%, but the following can make your symptoms more tolerable. It may sound cliche, but get plenty of rest, drink lots of fluids, and eat healthily. You can use medications like Tylenol and/or Advil to keep the fevers down, help your pain, and fight the body aches. I swear by throat sprays like Cepacol. Note, I mean the spray, not just the lozenges. You can spray it to the back of your throat and it will numb it for about 20 to 30 minutes. Then you can simply reuse as needed. Nasal saline flushes or neti pots can help those stuffy nose symptoms. Vicks VapoRub has been shown to help chest congestion and sinus congestion symptoms. Note, all of these are available over the counter and there is no need to see your doctor for them. I realize you are sick and you want to feel better as fast as possible. We often want to feel like we're doing something to get better. Unfortunately, as I hope you have learned, antibiotics generally do not help cough, cold, stuffy noses, sore throats, or plugged ears. It would have been easier for me to simply take 2 seconds to prescribe you antibiotics, rather than take the time to make this video and give you the proper education about your infection. However, that actually wouldn't be helping you. Needless doctor's visits and prescriptions for antibiotics costs our healthcare system a lot of time and money, and that costs us money in our taxes. Further, if we continue to misuse antibiotics, it will lead to more and more resistance to these medications, and there will come a time when nothing will work to fight our more serious infections. We have already started hearing about these superbugs in the news lately. Sometimes there is still reason to see a doctor. For example, if you have a severe or persistent fever, if you have a history of lung problems like COPD, emphysema, or asthma, if you have chest pains or trouble breathing, if your throat is sore more on one side than the other, if your symptoms are getting worse after 7 days as opposed to better, or if you are feeling very unwell or have any severe symptoms that you are truly concerned about. I hope you found this video helpful.